Hello, everyone. I'm going to give everyone a couple minutes to continue logging on. All right, yeah, just kind of waiting for everyone to continue logging on for our webinar. All right, so I would like to welcome everyone and thank you for joining us for our webinar today, Do Your Staffing Partners Care About Quality Assurance, brought to you by IntelliCare. I'm Amy Stulik with Skilled Nursing News, and I'll be moderating today's webinar. We welcome questions from the audience at any time, so please use your questions box on the GoToWebinar window to submit questions, and we will hold all questions for audience Q&A at the end of today's presentation. And today's webinar will also be recorded and distributed. Today, we are joined by Greg Hoon Jin, Administrator at Stone Rehabilitation and Senior Living, and Lynn Berry, MSN, RN, and Senior Director of Clinical Operations at IntelliCare, to discuss how better vetting the consistency of care external staff provides at your facility can lead to improved patient outcomes, higher CMS quality measures, an uptick in referrals, and ultimately increased revenue. I just want to say welcome to Greg and Lynn for joining us.
Thank you, Amy.
Yeah. And Greg, this first question is for you. So I'm curious why assuring quality of care is such a critical thing for skilled nursing operators right now.
Everything we do is for the care of the residents and the quality that we can provide towards the end of life in many scenarios, and for sometimes years and decades of residing in our nursing homes. The quality care is something that I think through COVID has taken a bit of a hit, where we kind of go into a little bit of crisis mode and going into what do we need to do as a task rather than what do we need to do for an individual. So when it comes to the quality of the care that we provide, who we have makes a difference. And instead of having a body, we want to have somebody that can provide something extra to build off a personal relationship and kind of drive that person-centered care. And yes, we have the regulations, and you can get really caught up in regulations, but I think looking beyond that and really looking at the individual that we're taking care of and the individual that is taking care of our residents.
Mm-hmm. And then Lynn, did you want to jump in there at all with any additional thoughts?
No, I think I agree, Greg. During COVID, it was just, all hands on deck, get the tasks complete. And now there's been a shift, right? And now we're having a little more time to focus on the individual and making sure that we have great caregivers. Perfect.
Correct.
So Greg, we're going to stick with you for the next couple questions, but Lynn, feel free to hop in as we move along. So next question for you, Greg. I'm curious how you train full-time staff to provide quality care.
Training can be a bit of a challenge, because when you look at the staff members that are coming in, we want to make sure we can cater a program that works well for them. It could be somebody who's a little more hands-on, somebody who can dive into more of material to look at. But I think the hands-on piece is the most crucial, and sometimes training can only take you so far, and it's the experience after that that goes further, because you can't prepare for every scenario and situation. But when we look at training, we try to give ample amount of time for the individual to feel comfortable in the skill set that they're learning and be able to ask questions, be able to maybe repeat a certain task so that they can feel more comfortable with it, rather than throwing them in right off the bat to the floor and feel like they're frazzled, and that kind of leads to retention or quality issues as well. So the training overall is very vital, and that educational piece is a very, very important aspect in order to grow, and not just for the purpose of the building, but for the individual and looking at the goals that they want to achieve in the long term. And I can speak to personal experience with that as kind of starting off as a CNA, a certified nurse assistant, and working my way up the ladder to an executive director and taking on those different roles, the growth and that exposure and having the right mentors in place have allowed me to go that far. And that's something that personally I look at giving back when I look at training new staff.
And we definitely hear that you do give back, Greg, because the IntelliPros that come to your facility do engage in some training with your staff, and they feel welcomed and oriented a little bit, which is really quite nice.
And I think coming in as the IntelliPro, you're going into a new environment sometimes, and trying to adapt to the facility you're going into can be a bit of a challenge, depending on the other people around you or just the atmosphere. And so trying to make it more comfortable and open it up to having the IntelliPro or anybody ask the questions to understand that we're here for you. We want you to be one of us. We're not just looking for a person or a body to fill a spot. And we look for quality.
Mhm. And then, Greg, you're also relying on external staff to provide the same level of care you expect of internal staff. I'm curious what challenges you have traditionally run into there.
Some of the challenges can be a bit of the skill set, or also being a new individual coming into our environment. And the expectation can be that, well, there are a temporary staff that are coming in and they've chosen to do this. So there are staff that feel like they should be able to adapt to any situation, be able to take on any sort of task, when in reality, they may have a certain level of skill set, but they're not trained according to what we're looking for when it comes to facility to facility. So that perception can be a bit of a challenge between internal staff and external staff. And I think trying to shorten that gap and eliminate that gap best as possible can really go a long way. And I think overall, it's a matter of the willingness of the external staff to be able to come in and feel like one of our own, and be a part of a team, rather than being, today my assignment's going to be at this facility and then I'm going to go to another one tomorrow. So trying to build that consistency as well is crucial.
And I think by including them in some of the orientation and the trainings that you do makes them want to come back, right? And then it builds that continuity of care and helps fill gaps not only in your schedule, but gaps in knowledge of the residents, which is really nice.
Mm-hmm. And then, Greg, how has your experience working with IntelliCare been different in that regard?
It's definitely been a step above. I think there's a lot of preparation that's done behind the scenes, that when an IntelliPro walks into the building, you can feel confident you're going to have a certain level of quality. And I think you don't necessarily see that across the board. And it's just the easy communication that goes back and forth, and knowing that there's a team behind essentially each IntelliPro to be able to better each individual goes a long way. And knowing that you can go to a particular person behind the scenes to be able to say, we have something that we want to address, and being able to know that it's done correctly. And it may not be an issue, it just may be a point of education. And I think that receptiveness goes further with IntelliCare, in being able to adapt and mold to the changes that we do face in the field.
Mm-hmm. And Lynn, this next round of questions, we can start off with you for these. I'm curious how IntelliCare supports nurses and CNAs with required trainings.
So anything that's required, the IntelliPros, so the CNAs and the nurses, all have access to on our app, on our platform, and they take all of those required trainings before they go into the field. As far as additional trainings and upskilling, we have over 150 CE courses that are available to them at no charge, that they can take when they self-identify a gap or are just interested in something. So not only do we support them with education, we have a team of quality assurance nurses, and then the IntelliPros themselves have a success manager that follows up with them to make sure things are going okay, and if they're having any trouble on the app, or it's just another layer of outreach.
And that on the other end for us, it truly shows because you can see the preparation that's done in a lot of the IntelliPros that come through, and just the confidence level that they have, whether it's a skill set they already had or something that they've been able to learn. And it's definitely really helpful when it comes to the quality and as far as the assurance that we're going to have somebody with quality.
That's great.
And the over 150 CE courses is notable as well.
Mm-hmm.
It's interesting. So Lynn, IntelliCare also has a quality assurance department.
We do. So we built a quality assurance department because we really wanted our clients to be able to reach out to us when things weren't going right. We love to hear when things are going right, but we also want to know if there are gaps that are being identified in some of the staff, and how we can, quickly reach out to the IntelliPros, help support them, give them the education they need to improve and to be able to get back out there safely. Our quality assurance team, is nurses with a breadth of knowledge from many different kind of areas that are able to collaborate with each other and with our IntelliPros to successfully upskill and train for whatever the scenario might be.
And then, was there anything that you wanted to add, Lynn, about like this need for a QA team and the challenges the team addresses specifically?
Sure. I mean, I think one of the things that we recognized early on was, when I first joined IntelliCare, we kind of did a risk assessment. What are we seeing? What's out there? We hear about tardiness, we hear about that kind of behavior, but what about the quality issues as far as skills and clinical issues? And who are the right people to address those issues? So that's how we started the department, was just kind of wrapping our arms around the needs of the patient, right? We're all in this together to take care of patients and to take care of them really well. And we found that we really couldn't do that without a good quality team behind us.
That's a very valuable point right there, because I think that's what we as facility operators and managers and executives look at. We're trying to take that same approach on a day-to-day basis when it comes to each and every facility that we're in. And I think having that QA, the quality assurance aspect provided from an outside and external source, it's very helpful for us to know we're not the only ones in this, and we're not the only ones trying to make this a better place and provide that, that care. And I think it really helps drill in the point, like Lynn said, if there's any sort of issues, and issues do come up, and that's where we know that with confidence it's going to be addressed and looked at, and not just for maybe one individual, it's a matter of across the board, so that there's no other scenarios that may repeat itself that way.
And that's the point of it, right? I think that's the point of quality assurance, is to make sure that things don't become repetitive, to kind of nip it in the bud, get people what they need, and take care of our patients safely.
So Lynn, tell me a little bit more about what this department looks like, this QA department. I'd love to learn a bit more about the different roles of the department and the value delivered that maybe wasn't mentioned already.
Sure. So our department is made up of all nurses. And like I said, we have nurses who have various skill sets. We have nurses who are DONs, nurses who've worked in hospice, home care, assisted living, long-term care, acute care, infusion units, like did a wide variety of skills throughout nursing. And so at this point in their career, they've chosen to help other nurses, right? We want to give back, we want to upskill nurses, and we want to support these nurses who have chosen a very different way of having a career, right? One that works for them, one that due to childcare issues, or maybe they're going back to school or whatever the case may be, they don't want to be tied into a 40-hour-a-week job, right? They need to pick shifts that work for their life. And that being said, they may go into different facilities, and they need to have the skills to be able to know how to adapt and know how to problem solve and know where to go for issues. And so we're here for them too. So we don't want it to be something that's one way. We don't want to just hear about maybe clinical issues or allegations from the client side. We want our IntelliPros to feel like they have resource in us as well.
Hmm. And then also, I'm curious, why did IntelliCare decide to become a joint commission? Why did IntelliCare decide to become joint commission certified, I should say? Lynn.
So, Joint Commission accreditation is just kind of like a gold seal of approval. Like, you've got another set of eyes on you. And as an organization, you're constantly getting feedback from the Joint Commission. That's where standards are developed in conjunction with CMS guidelines and all of those things. And we get updates regarding that. And, it causes us to have a pathway for constant, continuous improvement in both our policies, processes. All of the policies we've written and processes in place are driven by the standards set forth by the Joint Commission. That, with the commitment to quality that both IntelliCare has and the Joint Commission has, seem like a perfect partnership.
Excellent. And then I'm curious how IntelliCare's QA team would handle a nursing professional that doesn't meet a facility's standards.
Sure. So when we get concerns brought forward by a facility, so the facility is always going to do their own internal investigation, but we also will do an investigation on our end. We've got a commitment to call every facility back that calls us with a clinical concern. We address it with the DON or whoever may have filed the complaint. And we also speak to every IntelliPro. We'll identify a gap in education or training. We'll assign them some education to do to make them safer in their practice. And we'll follow through with, reaching out to the DON and letting them know what the plan is to get that nurse back to work safely.
And I think Lynn pointed out the key word for safer practices and safety, because I think that's a huge piece as to any sort of allegation or any sort of incident that does arise. It's a matter of education, making sure that the practices are as safe as possible, and there could be a lapse in that. So knowing that and hearing that, it's great for us as on the facility end to know that we're not the only ones looking at that level of safety as well.
Mm-hmm. So before we switch back to some questions for Greg, I would like to remind our audience that you can submit questions in the question box on GoToWebinar at any time. We'll get to as many as we can toward the end of the conversation. All right. So Greg, one of the frustrations that we often hear about working with an agency is the inability to get someone on the phone. Is it typical to get this level of interaction from IntelliCare with other staffing providers?
IntelliCare has done a phenomenal job with communication, because I think whenever there's been a need, whether it's from the scheduler or it's off hours, IntelliCare is there and they're able to answer the questions or follow up with us as well. And I think with other agencies and other providers, it becomes more difficult because it may be a particular individual that's trying to do it around the clock rather than a team that's trying to keep that communication ongoing. And so the differences are felt there, and that's where the timeliness of a response helps us on the facility and for supervisors, managers that are working off hours to know that they have a means of communication to be able to fill a shift for a call out, or make sure that they're verifying the staff that are coming on are, they can call somebody to figure out, okay, we're making sure that everybody's going to be there on time, or if there's anybody who's late. So that is definitely a very added bonus to have in IntelliCare. It just provides a level of ease for everybody that's involved, not just me, but staff on the floor as well.
Yeah, there are a lot of eyes on our IntelliPros from our, and there's a lot of help there for the clients, from the client success manager who's there to support Greg, to our operations team who's checking to make sure people arrive on time, to the artificial intelligence we use on our platform to maybe even predict where we might need extra people. So it's really quite 360 there for you.
And the platform is it makes things even better and easier to use, because that way you can eliminate some of the waiting that takes place and putting out needs, or whether it's certain level of communication through the platform, the portal. There's a lot of agencies that don't use that or don't have that, and you're looking for texts or emails or phone calls, and that's where that waiting game kind of comes into play. So that's another advantage with working with IntelliCare.
And then going back to quality assurance, Greg, I'm curious, what do QA processes typically look like with other agencies?
We take a similar approach when it comes to QA. We look at, like I said, every individual as the individual and not where they're coming from, whether it's internal or external. And the QA process with other agencies can be the same type of approach, where we will call and try to notify them of an incident or an issue and something we want some follow-up on. And we don't, in particular cases, we don't necessarily get a full-on kind of follow-up. And it could just be something that you're told that it's addressed, but we don't have the details to what was actually done. And I think that's a huge difference, where we can understand what sort of education is provided. As the facility itself, we will go ahead and provide a certain level of education to any sort of external staff ourselves as well, so that we can assure and that information is provided. But having that level of assurance to know that somebody else is following up and reiterating what we're doing and what we're looking for is huge. And like I said, not every agency is able to provide that, or they don't provide that.
Part of the reason why they may not be able to provide that is so 1099 agencies really have little to no involvement with their staff, right? So if there's a problem with a staff member from an agency that uses 1099 contractor employees, they really can't have too much of an effect on upskilling them or providing them with the necessary tools they need to provide safer care.
And then, Greg, we can start with you for this one, and then Lynn, feel free to chime in later. In your view, Greg, does it matter how a diem nurse is employed? And do you tend to see a greater level of investment from a nurse or CNA employed as W-2 versus contracted or 1099?
I don't necessarily see too much of a difference when it comes to that. Occasionally, you can see some per diem staff that are less committed and invested, but I think when you can weed through the reasoning as to why they are contracted or why they are, per diem, and understanding the flexibility it provides, I think that's where you can get that level of commitment, understanding as a facility and what somebody is able to have time to provide, and actually being able to make it work with their schedule and their needs and their goals can really help optimize what we can get from each individual. And that may be just one particular shift a week, or it may be somebody who can do 40, but it's not your typical 7 to 3 every other weekend. It may have to be something that's pieced together with some doubles and just maybe 2-3 days out of a week, and being able to bulk the hours. So the differences that I see are more or less on that end, as far as making it work for the facility, not necessarily in the type of individual that comes through.
And then, Lynn, why does IntelliCare hire exclusively W-2 employees?
I think that IntelliCare is very committed to their employees, all their employees, whether you're corporate or you're one of the IntelliPros out there working with our clients and patients of our clients, right? The fact that we can help build their skills and help them to have a fruitful career in nursing is affordable to us because they are W-2. If they were 1099, we really couldn't have that same level of involvement. It's more hands-off. And I think our commitment to quality to remain with that level of commitment to quality, we really do need W-2 employees so that we can invest back into them. We offer them opportunities to go back to school, to invest in 401ks, to feel more like they're part of a community. And I think we really are committed to all of our employees that way.
Mm-hmm. And then I want to learn from you, Lynn, what operators should be looking at to vet quality when evaluating staffing partners.
Greg can probably speak to this better, but I think if I was going to employ nurses from a staffing agency, I'd want to know who's behind those nurses. Is there somebody to call? Is there a team of quality assurance nurses who are going to help support these nursing professionals to make sure that they can provide really good, safe, quality care to my, residents and patients? I think that it has to be something that's embedded in the organization, the company that you're working with. They need to all take quality seriously and have it something that's spoken to daily in all the work we do, keeping a patient as center and the focus of our work. We spent a lot of time kind of looking internally of what we had to offer and how we could work together to keep patients safer and keep our clients happy with the members that we send into their residence. I mean, these are these patients' homes. These are where they live, where they are long-term, and we want to make sure that they get well taken care of.
Yeah, it's said very well, Lynn, because I think the biggest one-liner I can say is that we all care about the positive outcomes that we provide. And I think that's a huge piece of knowing that there's a team like that on the other end, looking for the same goals for those keywords, our residents, my residents, and having that larger family that's able to provide our residents is what we're looking for. And that's just, that goes further and beyond just trying to staff a building, and it's really what we truly do on a day-to-day basis, and everything that we try to do, how would it safely impact, a positive impact on each individual resident.
And then lastly, Lynn, IntelliCare has made some significant investment in continuing education lately, which I think you touched on before. Can you tell me about IntelliEDU?
Sure. So IntelliEDU houses about over 150 CEs that are all ANCC accredited. So that's something that is a free benefit to all of our nursing professionals. We have CEs for nurses. We also have courses for CNAs. We have partnered with Sigma Theta Tau and in a return to nursing kind of certificate program, as well as we partner with Excelsior College to help our IPs who want to advance their career, whether they want to go from CNA to RN or LPN to RN, get a bachelor's degree, a master's. We help them through Excelsior College with that. We are working on a CNA certificate that would bundle all the prerequisites to get into nursing school so that they can further their career as well through this program. So I think that IntelliEDU is definitely a market differentiator for us here at IntelliCare. It's something that, like I said, all those CEs are free to all of our IntelliPros. And so we want to encourage the love of nursing and the love of learning. Nurses are lifelong learners. So it's really quite a benefit for us to have these things available to all of our employees.
Yeah, I think that's
Excellent.
amazing. I think that's really amazing overall because I think it's the matter of the growth and not just the what we're dealing with now, but I think the growth in the workforce and the labor and not being able to help each individual grow further to advance themselves and not just be kind of, oh, I guess in a way, okay to do what they're doing. Absolutely, there's nothing wrong, and they love what they do. But having that opportunity there, because I think a lot of times without that opportunity, somebody may not take that next step to try to grow. And having all those resources and options available just promotes that.
Mhm. And so it looks like we have some extra time for audience Q&A. So I want to open up uh, that portion of the webinar. So if you have any questions, please feel free to submit them and we will get to as many as we can. We do have a couple in the queue already. I think this first one would be for Lynn, but feel free, Greg, to hop in if you'd like. So someone asks, what is the most common clinical care concern reported by facility partners to the IntelliCare QA team? And what is the resolution process for that concern? There's a part 2 to that as well, but we'll do this first part.
I'm not sure I have the exact data on what is the most popular, but one thing we do here is regarding documentation. You know, I think, and Greg, you can help speak to this, I think with the amount of tasks and clients and patients that sometimes these nursing professionals have on their docket during the day, doing the hands-on care takes precedence sometimes over documentation for a lot of people, nurses, CNAs, and you know, we do hear that that's a concern. We've addressed this, you know, we always address this with whoever, whether it be a CNA, an RN, an LPN, whether it be medication or how many times people got out of bed or what their I&Os were, whatever the case may be, we do assign some education around documentation. We do speak to every IntelliPro, and it is an expectation of the job that documentation is done. It's part of your day. And you know, for the most part, we hear from the IPs that they just feel overwhelmed, that there's a lot of work, and from the facility, it's a different, you know, they are feeling frustrated sometimes that this doesn't get done completely, but definitely we work together with all parties to make sure that we set expectations, and we will send IntelliPros back, you know, if we're notified by a facility in a timely manner, we will send our nurses back to complete their shift.
Yeah, I'd have to second the documentation piece because any time that I've had to make a phone call, most of them have been regarding documentation and looking at it from the facility. And we try to look at what do we need required for the documentation to be able to understand the load that it's going to put on an IntelliPro, and not expect them to take on every single task and every sort of documentation that we as a facility would do, and being able to help navigate through. And as time goes on and we have a consistent IntelliPro that does tend to come in, then we can develop that documentation further into something more that is facility specific rather than that universal piece. And they're using different EMRs and different systems, so trying to navigate through that can be a bit of a challenge, and you know, making sure logins and everything are squared away.
Yeah, that's something we hear a lot of too. Is like, I didn't have a login, I couldn't find anybody, you know. So it's then writing it on paper and making sure they get it to somebody. And so it's just doing those trainings to get that critical thinking in there, you know, like, okay, you couldn't get your login, what should you do next? How can we problem solve around this? And that's perfect that you said that. it's an issue on both ends. It's hard. I think it's really a tough job to be a per diem nurse and go to different facilities with different EMRs and different ways of doing things. So it's always great to have conversations with DONs and how can we problem solve together, so that next time an IntelliPro comes into your facility, how can we make it work better?
And then part two to that QA question, Lynn, was how does IntelliCare handle investigations with no clear outcome? So, kind of like a he said, she said type of scenario.
So like I said before, the main investigation is done at the site, right? We don't take any patient information at all. We don't have any eyes on the facility. We can't see the physical, if it was a fall, a slip, but we can't tell, was there water on the floor, what was happening. So the primary investigation is done at the facility. What we do is we will call the facility and hear what they have to say, hear what their concerns are, if there's an allegation of, wrongdoing, and then we want to follow up with our IP. If the allegation is such that it's a safety issue, we definitely will put our IP on hold and not allow them to pick up any more shifts until we can come to some sort of resolution, right? And make sure that they're safe to practice. I think that it's always kind of difficult to do a third party kind of investigation because we're not there, we're not at the site. But we do our due diligence and we collaborate with the facilities to make sure that we can put people back to work safely.
Excellent. And another question here, also for Lynn. Do you assign staff to complete the CMS infection prevention and control training requirements?
If it is a required training, our IPs are doing it, right? So we have all kinds of required trainings on our app, and then we have some that are facility specific. So we're in several states, and even within one state, one facility may require something different than another. So yes, all required trainings are done and completed by our IPs through our app and through IntelliUD.
Got it. Thank you. And another question for Lynn here from the audience. How do you believe IntelliCare can attract the best qualified and highest performing nursing professionals to a labor marketplace platform such as IntelliCare?
So I'm hoping that nurses, right? Nurses, we're a tight-knit group. It's a small world and we talk a lot. And I'm hoping that the work we do in quality makes our employees, our IntelliPros, feel good about where they work, and they share that news, and it attracts other people who want to do a really good job and who focus safe care as something that they ethically hold very high in regard. So the hope is quality attracts quality. And I think we have a lot to offer. I think with our education and the opportunities to advance your career and benefits that we provide, including health and 401ks, I think all of these things are important to a lot of people and will help us to attract really great staff.
Yeah, I think that word of mouth is very valuable. I think that's where you can really create bonds and familiarity when you go into different workplaces and different settings. And I think the word of mouth is really the best way you can recruit. And it's the same tactic and approach we use. And I think that's where you can really build a strong team that way.
Mm-hmm. And looks like we just got another question, and I feel like this one might be more for Greg. So in facilities where per diem staff are used, how can the host facility make a welcoming environment? And what have you done to help make new people find a welcome shift to work in that what other facilities might find useful for that welcoming environment.
So one of the biggest things for welcome is it's simple. It's a warm smile and a warm kind of handoff. And I think that it goes a long way, because if the coming in and feeling like you're one of us is big. And I think that's what most of the per diem staff that have ever, the feedback that we've gotten is that we're there to answer questions. It doesn't matter who it is from the top to the bottom. It just, we're available, and we try to help better their experience overall, and you get them familiar with the physical plan, the physical layout. And one of the tools we use is an orientation checklist that we can go. And so if somebody's new to the facility, we can go around and show them some key areas and some, the med rooms, the closets, and being able to familiarize it a little bit. And that has helped in a number of scenarios. And also some of the key policies that we do have, and just understand in case of emergency what steps to take. And one of the fortunate pieces we have here is that we kind of have a staff member kind of always around the corner and always available. So we are fortunate in that sort of way. So we can pair them up with somebody to give them a key point person, and being able to say that if you're looking for somebody, here's who you go to. And that has been huge. And I think that has really been why we have a number of per diem staff that do come back and over. And and we can kind of keep a consistency on certain assignments that we have throughout the building, and that way they build a little level of familiarity with the residents as well. And we have residents that will ask for particular per diem staff as well. So those have been, it's providing that level of consistency and a level of familiarity that we would to our own individuals and our own staff members itself. And we have little perks here. We get the free lunch, and you have any sort of events that we are taking part in, we include any of those per diem staff as well. We don't leave them. We don't leave them out.
That's so great that you have like a little training program like that. One of the things we hear often from the IntelliPros or our per diem staff is like, well, what would make it easier? What could you have done, or what could you have said? And oftentimes we hear they would all love a little binder at the nurses station, like per diem staff, like go here, a little, resource, if you will, of where to find this and where to go, what the med room setup is, or what the floor setup is, and who to call, what to do if you can't get into the computer. So it sounds like you've got that covered, Greg, which is awesome.
Yeah, we like to provide the feedback too, anything on ongoing feedback. So if there's something real time that we want to, that's going on, we want to make sure everybody's included, because it goes down to, it may not just help us, it may help, when they go off to another facility, and they can kind of think back and say, oh yeah, that's right, that's something that I experienced over at Stone. So, carrying that forward just kind of improves the overall industry, rather than just looking at it from facility to facility.
All right. Well, it looks like that is all the questions that we have in the queue. So I would like to thank our audience for joining us, and of course, Lynn and Greg, for a great discussion. I would like to wish everyone a great rest of your day. Thanks.
Thank you, Amy. Thank you, Greg.
Thank you.